This is Dr. Branco from Tamalpais Pediatrics. I wanted to share some information with you about a new immunization we have called Beyfortus or nirsevimab to prevent RSV in infants. This is not going to be a quick video and there will be no dancing, but if you don't have time to watch the whole thing now, feel free to save it for later. The short version is that if you have an infant who is not yet 8 months old, we would like to see them and get them protected against RSV, so please give our office a call. The longer version is RSV, Respiratory Syncytial Virus. A lot of us have heard about this. It was part of the Triple-Demic last year, along with COVID and influenza, and so it was in the news quite a bit. RSV is something that all pediatricians worry about and see a lot of with well over 150 years of combined experience in our practice. We have all spent lots of nights taking care of kids with RSV and worrying about those babies. RSV causes 2 million doctor's visits in the United States for kids. It causes about 500,000 ER visits for infants and children in the U.S., 80,000 hospitalizations, and between 100 and 300 deaths, and about 100 of those deaths are in infants under 12 months. Everyone gets RSV by the time they're 5, and so we've all had it. For older kids and for healthy adults, it really is just a cold, maybe with a worse cough than usual, but really just a cold. For infants and for the elderly, it can be more serious. In infants, it causes something called bronchiolitis, which is when the virus causes lots of inflammation in the lungs and lots of wheezing. All the mucus and the wheezing can make it really hard for babies to breathe and get enough oxygen. Typically, our treatment is to make sure that babies are getting enough fluids and staying hydrated and getting enough oxygen. And those that need to be in the hospital will be hospitalized for that. There really aren't any medications that treat RSV. It's just supporting kids until their lungs heal up and get rid of the virus. It is something that's really hard to prevent. You're contagious with RSV a couple of days before you get sick, and for up to 8 days after you get sick. The virus does live on surfaces, and so touching something with the virus on it and then touching your nose or eyes or your mouth or being around other folks who have RSV are ways that it's spread. We typically see RSV in our community starting in September, October. I'm recording this video at the beginning of October, and we've already seen several cases of RSV. It'll peak in January or February and then is typically gone from our community for the most part by April or May. In terms of preventing RSV, I already talked about how contagious it is and how easy it is to spread and how hard it is to know that you have it. We could put babies in a bubble, but even that doesn't work so well. For many years, we've had a preventative antibody that's called Synagis that we would use in high-risk babies. And so babies who are premature or who had heart or lung conditions. That's something that we would give once a month because that antibody didn't last very long. We now have an immunization, a medication called Beyfortus or nirsevimab. It is an antibody against RSV that has been modified to last for 5 months, or at least 5 months. So what that means is that babies would get 1 dose. It's recommended for all babies until they turn 8 months, and then for older babies up to 19 months if they have heart disease, lung disease, or extreme prematurity. That dose is given once and it will last for 5 months, so the intent is to get them through their first RSV season. It's a monoclonal antibody, and monoclonal means that it targets one thing, so it just targets the RSV virus. It's not a vaccine. We're not actually giving the virus or a piece of the virus and asking your immune system to react and respond to it and make the antibodies. We're giving you the antibodies directly. So it is an immunization, but it's not a vaccine. Antibodies do eventually wear off in your body, and so we know that from 1 to 3 months after antibody levels start to decline after an infection or a vaccination. With nirsevimab, it is designed to last for up to 5 months. In terms of side effects, in the studies they did for licensing. The side effects were pretty mild. There were mostly local reactions and some rashes where the shots were given. There were some allergic reactions, and so if your infant has ever had an allergic reaction to a vaccine or a medication, we should talk about that before giving the antibody, before giving the nirsevimab. And then in terms of how effective it is, the studies that were done, there were sort of three groups that were studied. There were the premature infants, there were less premature infants, and then infants who were born on time or born at term. And in all three of those studies, there was a decrease in how many kids had medically assisted RSV. And so what that means is just anything from a doctor visit to a hospitalization, and the rates of decrease. So they decreased the rates of visits to the doctor by 70% and significantly decreased the rates of severe disease, hospitalization, death. So, it's something that was found to be really effective in the studies and that we are very hopeful for, because we really want to prevent RSV in these infants. There is one other new way to prevent RSV that I'll mention. It's called Abrivso, and that is a vaccine. So that's a vaccine that is given to pregnant moms. It's also used or recommended for the elderly in order to prevent RSV. So you may want to check with grandparents and encourage them to get vaccinated against RSV if they haven't already been. And if you're pregnant, this is something that your obstetrician may offer you at the end of your pregnancy. It's recommended between 32 and 36 weeks of pregnancy, and we really need to give it at least 2 weeks before baby is born in order for it to be effective at transmitting those antibodies to infant. And this vaccine, if given to moms at least 2 weeks before a baby was born, prevented about 80% of RSV disease for the first 3 months and 70% for the first 6 months. So another effective way at protecting babies. Obviously, if you've gotten so during your pregnancy, then we would need to do the Beyfortus, so that's something that we would want to know about. The last thing I'll talk about is our plans here at Tamalpais Pediatrics. We have been working hard to get information about insurance coverage and ordering and how to give this vaccine, the immunization, and just how effective it is. We all think it's pretty important for infants to be protected against RSV now that we have this effective treatment. And we're encouraging all infants up to 8 months to come in and be protected. Like I said, we're working hard to figure out insurance coverage. That's been a real issue for pediatricians. And so we hopefully will have information about your particular insurance. We also encourage you to call your insurance and ask them if they're covering it, and if they're not, why not? And we're happy to help with that. If you have more questions or you want to talk about this more, please feel free to call the office or send us a portal message, and we will share whatever info we have. That's it for now. Take care, stay healthy.